Hello everyone, my name is Dr. Nishtha Singh. I'm a consultant clinical psychologist with DocOnline. Today, we are going to talk about Alzheimer's, its symptoms, and the ways to decrease the risk of getting Alzheimer's. Did you know that Alzheimer's account for 70 million of all dementia cases? It is the most common cause of dementia, which affects over 55 million people worldwide and more than 4 million Indians. What is Alzheimer's disease? Alzheimer's disease is a progressive, incapacitating neurocognitive disease that slowly erodes an individual's memory, clouds thinking and judgment, impairs cognition and learning, and eventually the ability to function independently is lost. Alzheimer's negatively impacts behavioral and social skills, affecting mood, behavior, overall personality, disposition, and sense of self. Some of the common symptoms of Alzheimer's disease include forgetfulness, that is, short term memory loss, which means asking repetitive questions or repeating conversations, losing track of events, losing things, forgetting appointments. This progresses to long-term memory loss. There is impaired decision making as well, where the person feels confused or overwhelmed by routine tasks like paying bills or going grocery shopping. Then there's also difficulty finding the right words, making errors while speaking or reading. There's difficulty performing basic tasks of hygiene or self-care, such as getting dressed or taking a shower. There's also social withdrawal sometimes, which means the person loses interest in hobbies, they sleep more than usual, frequent mood changes are experienced, and there's social inappropriate behavior. Now let's talk about who is at a higher risk of developing Alzheimer's disease. Did you know 1 in 9 people age 65 and older has Alzheimer's disease? Age is the strongest risk factor for Alzheimer's. Although the condition is not a normal aspect of aging, the genetic roots of Alzheimer's are not yet fully understood. However, early onset Alzheimer's, where people younger than 65 years of age are affected, is strongly linked with gene mutation. In general, older women who have a parent or sibling with the disease do appear to be at higher risk. Other causes may include poor quality sleep, people with Down syndrome, post-head injury, high cholesterol, high blood pressure, diabetes, obesity, or smoking. They may increase the risk of Alzheimer's disease. Now, one may ask, is there any cure for Alzheimer's? Unfortunately, there is no cure for Alzheimer's disease. The progression of Alzheimer's disease cannot be slowed down. However, medicines are prescribed to improve the symptoms and reduce the impact of the more troubling aspects of this illness. Behavioral and psychological symptoms of Alzheimer's can be the most challenging problems that the caregivers face. Family support and environmental manipulation are important components of the treatment process through which a patient's behavioral problems, confusion, and agitation can be managed. An environment with reduced stimulation, relaxation therapy, and massage may be considered to improve the quality of life of a patient. Now let's talk about some of the things that can be done to decrease the risk of Alzheimer's disease. Number 1, eating a healthy diet, including antioxidants and omega-3 fats. Number 2, staying socially and mentally active by learning new skills. Number 3, getting regular exercise and keeping stress at bay. Number 4, avoiding smoking and alcohol. And number 5, controlling high blood pressure, diabetes, and cholesterol. A patient with Alzheimer's disease needs tender, loving care with respect and dignity. It will be best attained through joint efforts from a healthcare provider, caregiver, and the society.